Hello, everybody. Hello, everybody. Welcome back. This is DangTeach at CCSD. Today's lecture will be about the pharmacy technician. So I'll go over the roles, expectations, pharmacy technician. And if you like what you see and interested, please contact the school and let them know Dang sent you. The link is in the description. Today's learning objective. Let's see. Job roles related to the pharmacist. So we'll talk about what the technician can and cannot do. Personal standards, high personal standards in pharmacy. We'll talk about HIPAA, Health Insurance Portability and Accountability Act. We'll also talk a little bit about OBRA. That's the Omnibus Budget Reconciliation Act, in this case, the 1991. How to become a pharmacy technician. We'll talk about the different ways and how to certify and renew your certification. Pharmacy technician. So basic level of training as opposed to the pharmacist. They're going to get a expertise level of training. So there's going to be certain things that only a pharmacist can do. Let's take a look at training. Community college, for example, in this area, we have a regional occupational program, and that's just through, I believe, Grossmont in this area. Career colleges, so these are those 8 to 10 month programs, no degree, or in some cases, just on-the-job training is required. I believe Colorado and Pennsylvania doesn't require any formal training except on the job, documented training by the pharmacist. Definitely the pharmacists rely on the technicians. For every one pharmacist in California, you're only allowed 2 technicians under their direct supervision. In other states, other settings, it might be more. Any other task that doesn't require the pharmacist's supervision is not included in this 1-to-2 ratio. Things that only a pharmacist can do. So this is drug counseling. So when patients pick up their medication, only the pharmacist can do the counseling. The pharmacy technician cannot. This is a lot different from the medical field. If you are a medical assistant, and you're at a doctor's office, then you may need to educate the patient on their drug and maybe administer the first dose. Only the pharmacist can interpret data. The data I'm talking about is maybe patient's lab results and then adjust dosage accordingly. We'll talk about different settings. Most of us are familiar with retail and the hospital. So community is another way of saying retail pharmacy. They service the community. And in certain special settings, you may require extra specialized training or skills. Especially in the hospital, you'll have IVs and maybe more complicated compounds. The pharmacy technician. So the things that the technician will be doing is definitely taking in prescriptions, whether it's hard copy, electronic, faxed. They will take in patient information, so not only their name, but more importantly, their insurance information, allergies, current drugs. Definitely fill the prescriptions, so technicians can fill. Technicians can also compound. By law, only a technician, pharmacy technician, or a pharmacist can compound, and a compound requires at least 1 pharmaceutical ingredient. You'll work with professionals, pharmacists, other techs, doctors, nurses. Definitely some ordering, some inventory control. These 2 things are usually linked. And of course, using computers. Review question. Which tasks can only be done by a pharmacist? Filling prescriptions counseling patients, compounding, taking in prescriptions, interpreting data, taking phone refill authorizations, taking new prescriptions over the phone. So only the pharmacist can counsel patients. Only the pharmacist can interpret data like lab results. And only the pharmacist can take new prescriptions over the phone. So you might be asking, well, this is a verbal order, but this is pertaining to refills. For refills, everything pretty much stays the same. We're just giving them another dispensing. So in that case, as long as you document who was from the doctor's office making that call authorization, then that's definitely fine in California for the pharmacist to take phone refill authorizations. Personal standards. So yes, a member of the healthcare team. So technicians are referred to as paraprofessionals. We work closely with the professionals, in this case, the pharmacists. In pharmacy, since drugs have profound effects, any failures can lead to death of the patient, up to death of the patient. Work with others, definitely. In retail, you'll have a lot of patient contact. Communication is always good, and do what's expected of you. HIPAA, Health Insurance Portability and Accountability Act. So HIPAA has two parts. Portability, and this is for transferring or receiving healthcare coverage when you leave your job and pick up a new one. And the accountability part. So this is what keeps your health information private, because if you're changing jobs, your health information can be used against you and you can be disqualified from a job because of your health history. So that's the accountability part. And it established PHI. PHI is protected health information. Dependable. So for on-ground classes, I can tell you which students show up on time and which students do what's required of them. And their habits in school usually transform into the workplace. So the instructor is probably the best guide as to if this potential pharmacy technician would be a good hire or not. Detail-oriented. In pharmacy, you'll need to learn math calculations, SIG codes, and any little error may be life-threatening to the patient. Pharmacy is always ranked top trusted profession year after year. So as a technician, can I trust you with HIPAA information? Can I trust you with narcotic drugs, expensive items, and the equipment? Personal guides. Health, not just your physical health, but more importantly, your mental health. So come to work rested, you'll limit errors, and also rest your mind. If you're preoccupied or distracted, that may lead to more errors. Hygiene. You will be working closely with others. If you ever peek your head back in the pharmacy area at the community pharmacy, you'll notice it's very small, working closely, almost shoulder to shoulder sometimes. Poor hygiene, definitely. You can spread diseases in the healthcare environment. Your appearance. Uniforms. Students sometimes come to class without their uniform, required uniform. And this is to get them used to coming to class, being in uniform. That way we can identify you. We know who needs to or who's supposed to be on campus. And if it's a pharmacy, we know who's supposed to be in the pharmacy area. Nails, just like any other healthcare settings, must be natural and kept short. Competency areas, mathematics. That's a big one for a lot of you guys. But we'll go through the math calculations in detail for this course. Language and terminology. So medical terminology is covered in subsequent chapters. I'll do a little review of that for you guys. And pharmacy abbreviations. So we have SIG codes. Those are the directional codes doctor writes on prescriptions. The technician will need to be able to read and decipher those codes. Computer skills, nothing to mention there. Computers incorporated in almost every profession these days. Interpersonal skills. So definitely you will need to work with others well and efficiently. Under HIPAA, what does PHI stand for? Is it private health information, protected health information, personal health information, patient health information, portable health information, or none of the above? If you answered protected health information, you would be correct. So just remember, protected. A lot of P words, but the one you want is protected health information. Training and certification requirements. One of the largest pharmacy organization is ASHP. The acronym doesn't match, but they changed their name. Used to be just hospital, but now it's multiple health systems that they cover. They establish national standards for RTs, and if you're doing any training, must be endorsed by the Pharmacy Technician Educators Council. So if you have to do any CEUs, make sure that they are covered and endorsed by the PTEC. Training and competency. So it's your employer who tells you what you need to do on the job, and it's also your employer that will evaluate your competency. So your competency is your knowledge of what to do, but also your ability to do it. So they'll evaluate you in many ways. Maybe a test, maybe an eval. Definitely need to know your drug laws, terminology, prescriptions, how to perform calculations, various drug routes, dosage forms, infection control. So within the series of pharmacy classes here at CCSD, you'll go through all of them. Making IVs, drug classifications, how to handle inventory, how to research literature. So we got USP, National Formulary, the Red Book, Physician's Deference. A little bit on drug activity. We'll cover that in your pharmacology courses. Competency on the job. So you will be required some training. And once your training is complete, whether it is on the job training, videos, reading manuals, you'll need to be tested for competency. So written exams test your understanding, demonstration and evaluation demonstrate your ability to perform the tasks. Continuing education. So staying certified will require CEU units. However, if you're licensed in California, you do not require currently any CEU units to renew your license. It's only if you are a certified pharmacy technician do you need the CEU. Your personal profile. So all the documents accumulated throughout your employment cannot be discarded. So even if you had a bad review, it's going to stay in there permanently. When you leave the job, don't burn any bridges because you never know when you might come back. And this personnel file will still be available for your new supervisor to review. Certification. So certification, once you're certified, you can be a CPHT. So this is different from an RPHT. So an RPHT is a registered pharmacy technician. And in California, that's what you're required to practice pharmacy. Now, if you passed and you are a CPHT, then that would qualify you in California to become a pharmacy technician. So we got the PTCE, so the Pharmacy Technician Certification Exam given by the board. And we have the exam for the certification of pharmacy technicians given by the Institute. And if your state has its own exam, then that would qualify you to become a pharmacy technician in that state. Comparing the two exams, very similar in their layout. Let's see, 2 hours. It's about 75% to pass. The PTCE is hospital focused, more hospital focused. The EXCPT is more retail focused. And I think because the PTCE is hospital focused, more states will accept that for licensure. Review question. The pharmacy technician certification review requires how many hours of CE units, how often, how many years, and at least how many hours in pharmacy law? Very good. 20 hours of CE units every 2 years, 1 hour in law. And the new requirement, 2018, let me write that down. You'll need 1 hour in patient safety in order to renew, starting in 2018. Okay, well that concludes our presentation on the pharmacy technician. And I'll see you guys next time. So thank you for joining me. And if you like hiking and beer, check out my brother's channel. I put the description or put the link in the description below. Thank you.